Please welcome Executive Director of the American Heart Association, Bernard J. Tyson Impact Fund, Denise Bradley Tyson.
Hello, and welcome to the Bernard J. Tyson Memorial Panel, Achieving Equity for All, proudly presented by the American Heart Association CEO Roundtable and the Business Roundtable. I'm Denise Bradley, and my late great husband, Bernard J. Tyson, was a proud member of these leadership collaboratives. As the chairman and CEO of Kaiser Permanente, Bernard was forever fearless. He stepped up and spoke out whenever he witnessed injustice. Bernard shook up social systems because he firmly believed that every person deserved to live a full, healthy life. I am honored to work with the American Heart Association and the Impact Fund in his name, where we invest in communities coast to coast with solutions that help people live healthier lives. I know Bernard would be so proud of the leaders who are joining us today, all of whom were both professional colleagues and friends who he deeply respected, to hear them talk about a topic that was near and dear to him. Before I turn the program over to another person Bernard deeply respected, Editor-in-Chief of Fortune, Mr. Cliff Leaf, I have to take a moment to express my gratitude and give a huge thank you to Ken Frazier and his amazing wife, Andrea, for their $1 million gift to the Bernard J. Tyson Impact Fund, which was just announced this week. With that, I am honored to introduce Cliff, whom I also have to express enormous gratitude for having Fortune sign on as a media partner of the fund. Cliff will moderate today's discussion with these dynamic CEOs to talk about how we collectively address barriers to health to improve employee and community health. Cliff?
Thank you, Denise. I'm so proud and honored to call you a friend, as I did Bernard for so many years. You know, through my role, I've gotten to meet and get to know so many corporate leaders, and there was just something about Bernard was just so special. He was charismatic, as you said, a fearless leader, a visionary. I mean, that really was what distinguished him from so many others. And when he passed away in his sleep at the tender age of 60 in November 2019, many of us feared that we would lose that vision. Well, I am thankful and pleased to say that that vision has an afterlife, and you have helped keep his mission alive. So thank you so much for that, Denise. His words, his moral force, his fearlessness. And part of that is through the Bernard J. Tyson Social Impact Fund, which, thanks to the work of you, Denise, and to the AHA, has really come alive to carry out his vision of a total health commitment. And part of that is through conversations like this one. We have an amazing opportunity today to talk with some truly visionary corporate leaders. Today's discussion, as Denise said, is brought to you by the American Heart Association and the Business Roundtable. And joining me in today's conversation are 6 leading CEOs, including the American Heart Association CEO, Nancy Brown, who's also a friend. And I'm also pleased to welcome Marvin Ellison, the CEO of Lowe's Home Improvement Centers and a member of the AHA CEO Roundtable. Ken Frazier, CEO of Merck, and also a member of the AHA CEO Roundtable. Alex Gorski leads Johnson & Johnson as CEO and is also chair of the Business Roundtable Corporate Governance Committee and the co-chair of the AHA CEO Roundtable. Brian Moynihan, CEO of Bank of America, and also co-chairman of the AHA CEO Roundtable and a member of the Business Roundtable. And Arnie Sorensen, President and CEO of Marriott International, Chair of the Business Roundtable Racial Equity and Justice Subcommittee on Health, and Chair of the Standing Business Roundtable Health and Retirement Committee. it's a mouthful of titles, but all of this adds up to some extraordinary leaders, many of whom I've gotten to know over the years. Nancy, I want to start with you, and if you would ask you to set the stage as CEO of the American Heart Association, what your organization's position is on health equity and why it's so crucial and even more crucial today.
Yeah, thank you, Cliff, and thank you, Denise, and to these incredible leaders of the Business Roundtable and the American Heart Association CEO Roundtable. I say thank you so much. I know Bernard would be so proud because everyone on this call is personally and deeply committed to change the trajectory of life for a lot of people in this country. I'll just start by saying that at the American Heart Association, we believe that every person deserves the opportunity for a full and healthy life. And sadly, that is not the reality for so many people who live in this country. That's why the AHA CEO Roundtable and the Business Roundtable are addressing issues of structural racism and health inequity in this country. Really, we all have had our awareness heightened by recent events, including the disparate impact of the coronavirus on populations in this country. But I thought it might be helpful to give you a couple of brief statistics just to frame the issue. Ken is from Philadelphia, Ken and Andrea. And just to say that in the Philadelphia area, someone living in Society Hills is expected to live 88 years, where someone living just 5 miles away in a North Philadelphia neighborhood is only expected to live 68 years. And you might ask yourself, why is this? And it's not just in Philadelphia, it's in cities and communities all across this country. We know that these life expectancy gaps occur in neighborhoods that are mostly segregated by race and ethnicity, with obstacles like poverty, untenable housing costs, unemployment, subpar social services that don't affect majority white neighborhoods to the same degree. And this is why Black people in this country are 32% more likely to die from a heart attack and 45% more likely to die from a stroke than white people. And people in rural America also have so many challenges, including accessing healthcare, and their life expectancy is 3 years shorter than people in urban areas. And we know that it will take a village to solve these problems. And at the AHA, although we've been working on these topics for many, many, many years, and most recently in partnership with Denise and the Bernard J. Tyson Impact Fund, most recently we published a paper that identified structural racism as a driver of poor health in this country. We know that structural racism persists, and it restricts the opportunity for long, healthy lives of Black Americans and other historically disenfranchised groups. So I'll leave it at that, Cliff. I know later we'll talk about the commitment the AHA has made to invest over $250 million in support of our 2024 strategic impact goal focused on health inequities. But we will learn a lot from these great leaders today about the work that they're doing as well.
Thank you, Nancy. That was perfectly framed. And it does conjure up Bernard's famous comment about the most important metric in a person's health is their zip code, not their cholesterol level or their blood pressure reading. So it's remarkably telling. Conjuring up Bernard, one of the things that he used to talk about was that his mission wasn't to think only about the 11 or then 11 million members of Kaiser Permanente's health plans, but rather to look at the 65 million people who lived in the communities that KP served. And as I look at this group of corporate CEOs, I did a little calculation today and found out, at least from the recent numbers that I could get, that you collectively employ 650,000 Americans, more than 1 million around the world, but 650,000 people in the United States. And Arnie, I want to talk with you a bit about the Business Roundtable's mission, because really your function is to serve the 330 million Americans that your companies serve and that your collective companies serve, not just those employees who are under your purview.
Yeah, thank you very much, Cliff, and it's great to be with so many good friends and on this panel today. Let me make one comment about Bernard. He obviously was passionate about healthcare. He was passionate about equity in healthcare. He was also a good friend to so many. I remember the energy that he would always bring into the room, sometimes in cocktail hour before we were meeting to have a more formal dinner, but he always had time. And he had time to connect. He had time to share and build energy. And as so many of us do who are passionate about our work, those conversations were both personal and they were also about what we could accomplish together. And so, Denise, our continuing condolences to you. Bernard will be missed by all of us for a long, long time. He was really a great force. Cliff, you mentioned the Business Roundtable. Obviously, we have had a extraordinarily difficult past 12 months as an American society and a global society, starting, of course, with COVID-19, but not long behind that, the horrific killing that we saw in Minneapolis that served as such a stark reminder of the problem of racism that continues in society today. Our chairman at the BRT, Doug McMillan, decided right after that, let's form a set of task forces to go after inequity in American society. Let's figure out how to drive greater equality and greater access to economic opportunity, to healthcare, of course, to education, to so many places where the impact, long time impact of racism has built up time after time after time. I was fortunate to be asked to be chair of the Racial Equity and Justice Special Committee's Subcommittee on Health. We moved quickly, and basically the philosophy of that task force, as well as the others, was to say, what can we as members of the BRT do individually? What can the BRT collectively do with all of its membership? And in those areas in which we can't solve the problems ourselves, what can we advocate for? In Washington and in state capitals around the country, so that we drive greater equity in healthcare as well as in other areas. We consulted with 100 healthcare experts to get into this, and there's so many experts on this call who understand the enormous complexity around this. And some of these things, maybe the last I would talk about is the social determinants of health. But in many respects, that is the impact on economic resources, on neighborhood resources, on healthcare resources in the neighborhoods we live in, and how so often that deck is stacked against people of color in the United States. Mm-hmm. To fix those requires more than just fixing certain healthcare issues. It requires addressing societal unfairness, which is there and has been profound. But before we get to that collection, we knew that there were simpler things to look at. COVID-19 itself has had a disproportionate impact on communities of color and communities of poverty in the United States. And so we advocated quickly to make sure companies not only were doing what they could, but that the federal government was moving quickly on COVID-19 policies and make sure those who had the least access to healthcare were getting fulsome access to deal with COVID-19. I think the second thing we looked at was general access to healthcare. And we know that even with the benefit of the Affordable Care Act, there are too many in the United States without access to healthcare coverage. Some of them don't have jobs and therefore don't have the wherewithal to choose it. Some have jobs but choose not to avail themselves of healthcare because of the cost associated with it. But we reiterated what we've talked about in the past, which is ACA should be stabilized and expanded to cover all Americans, including those that don't have coverage, obviously, today. And then we looked very hard at things like the availability of healthcare in urban communities of color, in rural communities, and said we've got to make sure that we use telehealth. We've got to make sure that we use our social health networks. We've got to make sure that we use advocates for healthcare because too often, even when healthcare is available, it is distributed unevenly. And so all of that was put together in recommendations that could be adopted, again, by individual companies, by the collection of BRT companies as a whole, and then advocated on the Hill.
Yeah, I think, Arnie, that's a terrific summary of all of this work. You know, the words are so important, and Bernard used to talk about how important the words were. And you know, Ken, you know, I wish you would just spend a few minutes talking about the 110 program. I know it's a little peripheral to this, but what I'm struck by is that you talk about creating 1 million careers, not jobs, for Black Americans over 10 years, and what that distinction is and why that's so important here.
Let me just start by saying I too am really pleased to be with so many friends and colleagues in honoring the spirit of Bernard Tyson. He was an incredible life force. He and Denise were good friends of Andrea and mine. And, you know, I still wake up every day and I think about the fact that he's not here, but his presence is still very strongly felt. And I think today is a tribute to just how important he was personally and professionally to so many of us. So coming back to 110, I would say that, you know, first of all, there are huge links between wealth disparities and health disparities. As you know, in this country, the average African-American family has net worth of about $5,000, and the average white family has a net worth of about $150,000. And a big part of that is unequal access to education, unequal access to training, which leads to employment and careers. And so following the events of this summer, a number of us, the people on this call and others, started asking ourselves what we as corporate America could do to actually try to make this situation better. And we thought that hiring people was something that was in our wheelhouse. And so we began to explore the possibility that some leading companies could come together collectively to use their force to create a demand for African-American employees who did not have a 4-year college degree. And only something like 20 or 22% of all 26-year-old African-Americans have a 4-year degree. So to the extent that we have these requirements of a 4-year degree as a prerequisite to being employed, we are creating, in effect, barriers. Although they may not be conscious barriers, they become structural barriers to African-Americans' employment. And so we said, let's try to put together an organization where we can create the demand to work with organizations that train people so that these people can develop not only entry-level jobs, but careers that provide an opportunity for family-sustaining wages. Those wealth disparities link completely to the health disparities that were the focus of Bernard Tyson's life. And I have to say the Bernard Tyson Impact Fund, I think, is a great tribute to him, because at the end of the day, as Bernard would say, your zip code is more determinative of your health and your lifespan than your genetic code is. And so what we want to be able to do is we want to be able to empower people in those communities to make healthy choices, to have access to the right kind of health care so that they no longer have to live shorter lives or less productive lives. But all of these things come together: education, healthcare, employment. We can't separate these things. All of us who are fortunate enough to be where we are today have had the benefit of everything that this country offers. And I think if Bernard Tyson were here, he would actually encourage us to make sure that the American dream was available to everyone.
Yeah, that's exactly right. You know, there is a famous quote, it's often misquoted, but it's a famous quote by the Reverend Dr. Martin Luther King Jr. Of all the forms of inequality, injustice in health is the most shocking and the most inhuman, because it often results in physical death. And we've seen that obviously in the last year in striking degree with the effects of COVID-19 and the disparities in those outcomes. You know, Dr. King gave this comment in March 1966. It has been, you know, more than half a century, and we are still in a place where the disparities in care and disparities in outcome and disparities in access are just as stark as ever. You know, Alex, I'd love to just ask you a little bit about this issue of health equity and how structural racism plays into it. And particularly, I know Johnson & Johnson has an initiative on health equity. And just, I know you've been a vocal champion for sort of addressing this issue. Talk a little bit about what you're doing at J&J and why this is so profound in America still.
Thank you very much, Cliff. And Denise, first of all, let me say thank you for joining us here today. And I have to believe that Bernard would be just incredibly proud that I would be able to share the Zoom call with so many great colleagues who are so committed to this very important cause. And I have very distinct memories of sitting next to him at the AHA Roundtable discussions, where not only did we get the benefit of Bernard's very deep thinking and insights into these issues, but I'll never forget that deep voice and that deep belly laugh that would keep us all real as we were trying to say, hey, what can we actually do to take these things on? And we miss him dearly, but I couldn't think of a bit more important or better way to keep his spirit alive having this discussion. And Cliff, you're absolutely right. I think that the issues that many of us are talking about today and perhaps brought to somewhat of a pressure point by some of the events experienced in cities around our country this summer have really been simmering for way too long. And I think one thing that COVID-19 has certainly shown us is that without healthcare security in some way, we don't have national security, we don't have societal security, we don't have economic security. And it's particularly important in communities of color, the Black community. You know, if we look at incidence rates of cardiovascular disease, type 2 diabetes, cancer, even COVID-19, morbidity and mortality, and while the statistics are daunting, unfortunately behind these numbers are real people, our family members and friends who have seen this impact not only over the course of 2020, but unfortunately for the last several decades. Now, like many of my colleagues, I think we at Johnson & Johnson saw some of these events unfold. We kind of rallied to the cause saying we should never let this kind of a crisis go to waste without trying to make an even bigger difference. And as part of that, we put together a very comprehensive plan, recognizing that it's not just necessarily even an initiative, but we feel more a responsibility for a company like Johnson & Johnson, one of the largest healthcare companies in the world, to really take an active role. And that is, how do we get to some of these very important elements that are impacting these communities to make a fundamental difference? And so with that, we've launched a very aggressive commitment where we're going to be investing more than $100 million over the next several years, saying what can we do to better, first of all, understanding why are there these disparities, starting with things like COVID-19, working with Johns Hopkins to take a real science-based approach before we aim our arrows, you might say, trying to understand what can we do, whether it's the development and discovery of new medicines, new therapeutics, new vaccines. How do we ensure clinical trials are done in a more equitable way? What else can we be doing to reach out specifically to these communities, as we were talking about earlier, by zip codes, whether it's training healthcare workers, physicians, nurses, to get more people of color involved, to be able to have more culturally aware approach to care, along with the way that we actually deliver it. So while we're daunted by the challenge, we're also very much excited by the opportunity. It's something that all of our employees, I think, are very committed to. And we're committed to taking it on just like we have a business challenge, with the same kind of metrics, building it into our goals and objectives at a company level, at a division level, at an individual level. And we know we can't do this alone. It's going to take partnership with academic centers, again, with healthcare centers, community centers, my colleagues who are involved on this Zoom. But I think taking this kind of a comprehensive approach, we are confident that we can truly start to get after these long-standing systemic issues to really be able to make a difference. And we couldn't be more proud to be doing it in conjunction with the memory of Bernard and around such an important issue.
Yeah, absolutely. And, I want to sort of follow up on these words business challenge and what Ken had talked about just a moment ago in terms of building careers for African Americans. Brian, the world that you habitate, this banking world is about credit, lending, about opportunity, about starting businesses. And so you have a sort of ground's eye view of the challenges that many Black entrepreneurs face about getting access to credit, about building businesses, about starting careers, about even getting loans to go to school, and about the challenges there. What can the Business Roundtable and more, your company and the banking industry do to sort of help improve these prospects and lower the barriers to access?
Oh, thanks, Cliff. And first off, Denise, it's an honor to be here to honor you and Bernard and his legacy. So it's as co-chair of the HAL, second Alex's point, it was always fun to have him there. And the personal stories he shared were inspiring to the rest of the CEOs. So it's an honor for me to be here. As a bank, we lend in the communities. We have our branches, 30% of our branches in LMI communities. The hiring we do, we said a few years ago, we hired 10,000 people from LMI communities to work in our branches in the career path jobs. They start at $40,000 a year plus full benefits. That was what we were doing. And then about 5 years ago, in combination with some work that went on, a fellow named Raj Chetty and a fellow named John Friedman and a group of researchers about economic opportunity, we had the experience in Charlotte of seeing that study rank our headquarters town last out of 50 cities. And so that started a group working on it who looked at it and started to recognize that the opportunity question is so definitive, and then the zip code opportunity question and the racial opportunity question is really something that has to be looked at. In our company, we started moving along those dimensions, really driven by our teammates had seen the presentations and talked about it because we had them come to our senior leaders, our Hispanic executive group and our Black executive group, and they started pushing us saying, are we really doing enough beyond the lending we do, beyond the fact that we have branches? Are we doing enough to really help create opportunity in these neighborhoods to help change this gap? And that was going along and was going to come to me in the middle of last summer as a $500 million program that is completely different from the lending we do and other things. And then we had George Floyd and the COVID crisis and how it affected certain communities. And, we just changed it and went for $1 billion, doubled it up, and really focused in on this question of creating opportunity around the 4 or 5 things which all play on each other: health, jobs, small business, and housing. And as Nancy has educated us in the papers AHA has written, you have to remember that financial health, mental health, physical health, and it could go either way, but the reality is those things are all linked together. And so the social determinants of health, which Arnie spoke about, are critical. So we started down this road, and the first thing on the healthcare crisis, we said, what do we have to do? Well, we have to help people get tested. So with Howard University, we built out testing capacity there. We've probably through 20 million pieces of PPE to community centers. First it was hospitals, but now it's community centers and people just trying to give them information. Give them things that they'd otherwise have to pay for and not have a person make a choice between buying a mask and buying healthcare or some other food or something. And then we started into jobs, and I'm proud to be part of Ken's initiative and Jenny Remedi's initiative. We've worked with Marvin he happens to be in the same headquarters area, so we work together. The idea of creating skills, creating job demand that needs skills and finding the programs and really creating career path. And that's critical. And that's what we know will ultimately over time drive the opportunity. And so we've been looking at these various things. And then the other thing was equity. And I'm talking about equity as stock equity, there's racial equity. What we noticed across the country is 2 things. One, the MDIs weren't getting the amount of investment. So we now have invested about 12% or 5% in 12 of the 16 Black owned MDIs. We also have built a fund that will be $2 billion to go to equity to growth businesses owned by African Americans and Hispanics. We have commitments to micro funds. These wouldn't be the big private equity funds in each market that total about $30 and $130 million of commitments that we should be announcing over time here. And the idea is that growth equity component allows a family business transfer to take place from a current Black-owned business to the sons or daughters. Those are pieces that we weren't playing well as an industry. And frankly, the whole industry wasn't playing, even private equity. We're trying to create some ideas there. So all these things are linked together to try to think about this idea that basically the business system from a kindergartner all the way through to high school to college and community college, the idea of how we can train them, how we can make sure they stay on course from reading, how we can help them in middle school get exposed to STEM, how we can develop skills for careers, and then how we think about bringing the resource, not only us, but my colleagues, CEOs here, all driving it. And also embedded in that is the health question, which is another thing we're doing with some groups in Rise. We're starting clinics in the schools that have docs in them, and they can have a different outcome in the health situation than it would be for a school nurse. And we started that. So all these ideas are all about really closing that opportunity gap. And it takes an integrated program from health, financial health, mental wellness, physical wellness, because if you don't touch it all, and then you're really going to have an issue. And that's what we're trying to do, Cliff, with these programs. But frankly, all of us are just trying to push as hard as we can right now.
Yeah, no, I mean, I really appreciate the comprehensive approach there. But, key to closing that opportunity gap, Marvin, is the pipeline and the pipeline of leadership and building not just the careers that Ken talked about, but getting people into positions of executive power, of decision-making power, and particularly in boardrooms where we've made very little headway over the last 10 years. And just to put some statistics on this, between 2010 and 2020, according to a new Spencer Stewart analysis, female representation in S&P 500 boards grew from 21% to 47%. So that's a pretty significant growth. But minority director representation barely increased, about 10 percentage points, and it's only up to about 22% in 2020, roughly achieving the same level that women did 10 years ago. I know this is something that you're focused on. What can we do? Because we've talked about this for a while.
Well, Cliff, again, it's a pleasure to be here. It's an honor to be with so many esteemed colleagues. And I have to just start out by acknowledging Denise. It's great to see you. And although I didn't know Bernard for as many years as many people here, Bernard never knew a stranger. And I remember the first time we met out in San Francisco, he invited me to dinner with both of you at your favorite restaurant. And when my wife arrived, she couldn't believe someone as antisocial as I am would actually accept a dinner reservation or a dinner invitation. I said to her, "You haven't met this guy and his wife. They're really special." And so that began our friendship. And Bernard adopted me as his little brother, and I would hear from him almost every month with advice and checking in. And so he's someone that I'll always remember. And I want you to know we're keeping you in our prayers, and we're praying for your strength. And we know that you're going to continue to make a huge difference in his legacy. And this is definitely a reflection of that. And again, it's a pleasure to be here to participate in such a very important topic and for a very important person that so many of us love and will always have fond memories of. And Cliff, to your question, I think it's really important for all leaders, not just leaders with ethnic diversity like myself, who privileged, to run a large company like Ken, to make this a focal point, for corporate America and a focal point, for society in general. And I have to give a lot of credit, to Ken Frazier, who's someone that I've had enormous amount of respect for many years from a distance. As a young Black man, trying to go through the trials and tribulation in corporate America, there were just a small number of role models out there, and Ken was one, and Bernard was one. And so having the chance to now meet them personally, and with Ken to check in with him and seek advice on steps he's taken, to drive diversity and drive it in a sustainable way for his leadership team and for board membership has been something that I've really taken advantage of. And I think it comes down primarily to making it a priority. And you're right, the reason we were able to see such great improvement in female diversity in the board ranks is because it became a priority. And we now have to make ethnic diversity, specifically of Black executives, an equal priority because there's a lot of talent out there that is constantly overlooked. One great example is when I joined Lowe's, we had 0% of our executive leaders were Black. Now 44% And that happened in 2 years. I'd love to tell you that I'm a brilliant recruiter and I can find talent where talent does not exist, but that's not the case. It's simply that diversity attracts diversity. And because it was important to me, because it was important to my board, it became a focal point. And it will continue to be a focal point. And then it's important for me to share best practices as Ken shared best practices with me, and I'm sure with many, many others. But it's all about making this a priority, because once it becomes a priority, and once you learn as a company the value of having diverse representation on your board, so when you have challenging decisions to make, you have a representation of the marketplace. And I'm just really, really privileged that Bert Scott is a member of this organization, and one of the reasons why I am here participating is on my board. He's someone that lives diversity and is a great advocate for it, and also someone who's a great partner for me to maintain this as an ongoing priority for Lowe's. And so it's all about prioritization. It's all about making sure you have an effective assessment process and that you are attracting diversity, because diversity attracts diversity at all levels.
Yeah, no, and I think that assessment process is so key, because, at Fortune, we're famous for our list, our rankings, the Fortune 500, as you all know. Part of that is that you measure what you manage and you manage what you measure, right? And we have not really put the kind of same focus and urgency on getting these measures of diversity in our business and tracking inclusion data and seeing the career tracks of folks. So at Fortune, we're actually partnering with Refinitiv this year to include that diversity and inclusion data in our Fortune 1000 list, so that we can have some baseline for progress, because Marvin, as you said, you have to make it a priority. Part of what Bernard did so brilliantly was he would take that bully pulpit, right? He'd get on that. It never felt like a soapbox, because he was so jocular and fun and easygoing and had that big laugh, but it was a soapbox. And he used his position as CEO to put these issues front and center. I'd love to hear from each of you, and please just sort of jump in on whether you see that as an emerging role for CEOs now. I know Business Roundtable has taken this front and center, the need for CEOs to get out there. I was very encouraged that after the Capitol riots, so many CEOs went right out in front and said this is wrong and why, and it was an outrage and an attack on democracy. And I'd love to hear about your thoughts on the CEO as using that bully pulpit as someone who expresses the need for these things in a social way.
Hey, Cliff, maybe I'll just start and share a few thoughts.
Rangers lead the way, Alex. There you go.
Not a problem. Look, I couldn't be more proud, I believe, of the, I guess you could say evolution, but almost revolution among CEOs in realizing the very important role that we play, not only in leading our companies, but in fact, and particularly during really challenging times, of helping to look out for all of our stakeholders. And, for me, it's hard to believe that now it's been almost a couple of years since at the Business Roundtable, we were able to come together and frankly, chart a different path about what was the purpose of a corporation, what is the purpose of a corporation. And while, yes, the discipline, the rigor of generating returns for our shareholders is certainly important, they are one of several stakeholders. And there's no way that companies like all of ours can succeed, again, in an equitable, long-term way if we're not looking out for multiple stakeholders, our customers, our employees, our communities, people who depend on us, and people that we depend on for our success. And I think a very important first step was making an explicit statement about that change. And I think since then, there's been an expectation that I think you're seeing more and more examples of, as Arnie mentioned earlier, in some of the work that under Jamie and Doug's and other leadership, realizing that we've made that statement. Now, how do we put the accountability and the responsibility in place to make sure that we're living into that, particularly during times, as we've seen over the past year, where I think more and more there's an expectation that not only businesses, but business leaders must have a voice on many of these issues to ultimately help lead us as a country and as a world to get to a better place and to manage our way through them.
Yeah, absolutely. Ken, I'm just wondering whether, so much of what we, again, as I say, we manage what we measure, but we also sort of manage where there's an incentive, right? And when this is how people basically, their performance is often aligned with those incentives. And when we talk about real equity, when we talk about inclusion and diversity, how do we incentivize that kind of thinking and behavior at the management level, the senior management level, all the way up and down the org chart?
Well, I would start by going back to something that Marvin talked about, which is it's important to have a composition on your board of people who care about these issues. And, at Merck, we've been very fortunate to have a very diverse, highly skilled board that cares about these issues. And so they hold management accountable for whether or not we're actually taking concrete steps to try to drive the level of diversity that we think is appropriate within the company. I think the other challenge is frankly, a lot of people are in fact motivated not just by values, but they're motivated by the value of the compensation that they receive every year or over a long period of time. And, we talked about the progress that women have made over the past 20, 30 years. Inside Merck, we were very intentional about tying our senior compensation to diversity in a way that made sense to get more women in those jobs. I think if we were honest, there are challenges with that, and they particularly become challenges with respect to African Americans. I sometimes joke and say that when we're talking about this issue as it relates to African Americans, I know I can close my eyes and I can tell that we're talking about African Americans because you hear what I call the 3 Qs. And the 3 Qs are these quotas? Mm-hmm. Are we dropping our quality standards? And is the person qualified? Mm-hmm. And I think the challenge that we have in corporate America is that we want to make sure, obviously, that we're hiring people who meet our standards. But at the same time, we should know just from past practice that unless we actually create some appropriate incentives for senior managers to go outside their comfort zone, to mentor people, for example, who are different from them, then you're going to get the same kinds of outcomes that we've gotten in the past. So, frankly, at Merck, what we've decided to do is we're going to actually hold ourselves as a senior management team accountable in terms of our long-range compensation, in terms of whether or not the principles we articulate around diversity and inclusion actually show up, whether they show up in terms of representation, whether they show up in terms of surveys across the company, or where people actually articulate to us back that they do feel included inside the company. So that's what we're trying to do as a company. Can I just make one more quick comment about the last question about the role of CEOs in speaking up on these kinds of issues? I had the opportunity when I was a younger lawyer to teach law school during apartheid in South Africa. And South Africa had obviously very, very strong racial divisions, had very strong income disparities. The difference between our country and South Africa is twofold. One is we have stated creeds about our values in terms of all people being created equal and those kinds of things. But the most significant difference, I think, is that in the United States, the private sector is the primary creator of wealth and opportunity. And the private sector actually has the talent, it has the resources, and it has the infrastructure to change our country. The great thing about this country is we know how to reinvent ourselves over and over again. And that reinvention largely is driven by the private sector and by leaders like the people on this call. So I just want to say that in other countries where you have this kind of huge disparity in income, with this huge disparity in terms of opportunity, you could pick India as another country where you're either born into privilege or you're born into poverty. The big difference in this country is the private sector is the driver of where we go as a country rather.
That's a perfect segue to my next question to Arnie, which is, you know, the challenge for people of color in terms of starting businesses and getting that kind of credit and sort of getting their feet off the ground and getting the hand up in some cases and the mentorship. But one area where we've seen the sort of highest participation rate of in particular, Black Americans and other people of color is in accommodations and the food industry, where we've actually seen a pretty significant share of those business starters being minority from minority groups. Talk a little bit about what you can do as the sort of big kahuna in that area, as an industry leader, to help encourage that. And I know that, Brian, you've also helped to start some industries as well, in particularly in green, sort of green finance. But Arnie, I'd love you to talk a little bit about that first in the accommodations business.
So I'm glad you asked that, Cliff. Ken and I and a number of us have had conversations about the differences in our workforces and the importance of making sure, from my perspective, that we remember the millions of people who are involved in the service industry, either as entrepreneurs or as service workers. And they have every right to be treated with human respect and dignity as the fanciest executives like those on this call, period. And I agree 100% with what has been said already about the importance of diversity in the boardroom and diversity in the executive ranks, and making sure our companies are succeeding in that space, because I think, as Marvin mentioned, success breeds success here in many respects. If I can see me in the leadership of that company, I know there's opportunities that are going to be available to me. And so that is too quite fundamental. But there are millions of folks who are engaged, maybe in our business, working and serving our guests in hotels, maybe working in nearby restaurants, maybe working in other service industries. And we've got to make sure that we are doing what we can to say these jobs too can be and should be jobs that are empowered, that include growth and opportunity, that include equality and opportunity. For us, that is blocking and tackling. It is, are we doing things like having people have to opt out of healthcare instead of opt in? Making that one little change, maybe they still have a choice, dramatically increases the level of participation in the healthcare program. Because no action obviously goes towards coverage, if you will. It also makes sure that we're listening to folks. So one of the stories I love, we opened the Marriott Marquis in Washington, D.C., I'd say maybe 8 years ago, something like that, right next to the new convention center in Washington. And because there was city money involved, we were required to hire a certain number of folks from Washington communities, disadvantaged communities. And we hired, I'll forget the precise numbers, 180 roughly, who had never had jobs before. And that's not because they were 18 years old or because they never had an occasion to get a job before, but it was because they never had an opportunity to get a job before. And as they started, the work that was most important was the work done by the supervisors in those hotels, to help them navigate from a place where so much of us take this for granted, where we have a support structure at home. If a kid is sick, we have tools to deal with that. We don't end up not going to work. We have transportation tools. We have other tools to help us get through it. But for those supervisors to say, what are you experiencing in these first months or quarters or years of work? Have you signed up for healthcare? What are your circumstances at home? Not as a matter of patronizing lecturing, but instead saying, we need to understand what you need from us in order to succeed in these jobs. And 18 months afterwards, we had a heavy majority of those folks still engaged and excited about the work that they're doing. Now, I could go on about this for a long time, but externally, I think we've got to make sure that we continue to work with our suppliers to hotels. I think we got to continue to work with the food and beverage outlets that are nearby, which are often almost always entrepreneurial. They are often folks who are making a lifetime bet to see whether they can get something to work, and making sure we do what we can to help them succeed.
Right. You know, Brian, your job in a sentence is to bet on entrepreneurs, right? And that's what you do. You bet on entrepreneurs, you bet on business leaders, you bet on people growing their businesses and ultimately paying you back with interest, hopefully. So, but how do you make sure that you are sort of creating the next generation of Black entrepreneurs, of Asian entrepreneurs, of Latino entrepreneurs, and really doing that? And I know that you do that consciously, but talk a little bit about what you can do on that front.
Well, one of the things that is clear is that we need to provide, there's two ways to sort of drive wealth building. Ken mentioned earlier, is working for companies like ours, because if a person makes their way through a career path, they're going to, and continues to do it, they're going to have career oriented jobs, they're going to be hired in career jobs, they're going to make a lot of money. So we have to make sure that we get representation in all the major companies who pay well and have great benefits and have great training programs, great stewardship programs that mirror society, so we can create the wealth off of that. Then the second question is, how do you create the wealth in the entrepreneurial areas? And so, again, when we observe this, one of the issues is really, as was told to me, it's getting equity to the person who's none of their family wants them to come to Thanksgiving dinner anymore because they keep asking for investment in their business. And it'd be the kind of businesses that are in the supply chain that Arnie was talking about for his company, is that, everybody says, wait a second, you've asked me, it's 50,000, 100,000, 200,000. So we have, as part of this initiative that we just launched last summer, we recognize that need was deeper. There's a need across our 90 markets. And so that's where we built this architecture. We've gotten 300 funds to come in, and 300 that exist today. And we're trying to scale them. And frankly, the idea is that we're not going to be their sole sponsor, but we got to get their information oriented, because there is a lack of core growth capital, not to the sexiest company that's doing biotech or cybersecurity. Those things get attention, but to the core 15 truck company that wants to go to 20, to the core that needs the equity for us then to lend to them. And that's what we're doing on that. So we'll get $200 or $300 million committed, and then we'll probably go back and do more. Then on the lending side, we are the largest small business lender, and we have really realized that you need both lending and you need education, skill building, and entrepreneur building. And when you get down to really micro business, that's our work with the CDFIs. They can do the kind of local coaching and local understanding. So we went from $1.5 billion invested in those CDFIs to $1.8 billion. And likewise, with the minority depository institutions, we also said they need more equity to grow faster, and they'll reach a client base. In our deal with the CDFIs, if the client's bankable by a bank like ours, let's get them into our system. If they're not, you can help them get that, so they have the 5-year track record, a 3-year track record that trucking company may need before we can lend to them. So one is putting the equity in, that growth equity, and I think all companies should be looking in their communities to help support the structures that drive that. The second then is to use the and this came out of the BRT recommendations with the financial services team that Jamie and I and others worked on, try to figure out how we get more money in the CDFIs, because they have both local counseling and coaching and the cash that come together and help a person needs a $10,000, $15,000, $20,000 loan get started, but also are making sure they're doing it the right way. So we look at it, and I think it's incumbent upon all of us to drive it.
We just have a few minutes left. I want to get to the heart of the matter, which is structural racism and its tethers are many and they run deep. And just if you could focus on one thing, each of you, that you could do to just tackle first. And I know it's an impossible question, but that's why I'm giving it to you first, Ken.
Jobs.
Jobs. Okay. Marvin?
Look, I've said create an environment where it's comfortable to have uncomfortable conversations. We have to be less quick to be offended and more apt to want to educate and teach each other the impacts that society and racism in society has on all of us. So create an environment where people can have tough, uncomfortable conversations in a safe manner that they can learn, grow from it, and be better leaders as a result of what they've learned.
Brian.
It's a different version of what Ken said. I think we have to admit that the economic opportunity gap, it has to be closed, and it has to be closed by skills and jobs and getting people employed in career path jobs. And so I think it's about jobs, but I think it's about career jobs, and that will close the opportunity gap, and hopefully that will then lead to the types of atmosphere that Marvin talked about.
Alex, you want to tackle that?
Eradicate racial and social injustice as any kind of impediment to healthcare, because without health, we won't have wealth, and bringing those two things together will make a huge difference.
Arnie.
Well, it's hard to top jobs, but since we're on a healthcare panel, I would say stabilize and expand the Affordable Care Act. Let's make sure everybody has got coverage.
Well, as Bernard would say, health is so much more, it's so much larger than health care. It really is about having jobs, having safe streets, having food security, having opportunity, having all of these things. And I just want to spend just a couple of minutes. One, we have to thank Denise Bradley Tyson for her continued inspiration, for carrying on this great legacy of her husband, for championing the hard conversations that we have to have. And I want to thank Nancy Brown and just ask you just a little bit more to talk about this phenomenal fund that you've got and the work you're doing to really tackle all of these aspects of structural racism and why this is so important to your mission. So Nancy, if you would just sort of finish us up here.
Sure, I'd be happy to. And, I have to first say, I remember a call I had with Josh Bolton at Brian's suggestion several months ago as the BRT was beginning to work on these issues. And I just have to say, Arnie, when I read all of the words, it's as if the American Heart Association wrote that playbook for the BRT. And we're so honored to work together and look forward to continuing to work to address these issues in our companies, as well as in our communities. And that really is the purpose of the Bernard J. Tyson Fund. We've talked about the problem, but words and intention are one thing, but what is the action? And so we recognize that probably the most lasting solutions to all the things we talked about, housing, healthcare access, food insecurity, access to jobs, access to education. These problems will get solved at a local level, and they often are solved by people who are in that community, who live there firsthand and see and understand these problems, but have no idea how to access the capital that Brian has to give or the great ideas that we've heard about. And that's the purpose of the fund. We go out and find individuals that are committed to solve these problems in communities, and we help them understand how to access the resources through the Bernard Tyson Fund and through other places to be able to solve problems. And through the Bernard Tyson Fund and the AHA Impact Fund, we've already, in a very short time, raised $20 million towards our much larger commitment, because we know that these problems will get addressed locally, and we're honored to work with Denise in Bernard's name to bring this to reality.
Well, thank you, Nancy. Thank you, Alex Skorsky, Marvin Ellison, Brian Moynihan, Ken Frazier, and Arnie Sorensen. Great conversation. Thank you.
Thank you.
Good to see you.
Thank you.
Thanks, everyone.